Mediclinic has swung to a full-year headline loss per share of 136 cents. This due to certain once-off items relating to the refinancing of the group's debt. Despite this, the group has increased its dividend payout to 60.5 cents. And joining us on the line for more detail on the numbers now is Mediclinic's CEO, Danie Meintjies. Thanks so much, Danie, for joining us this afternoon. Well, as I've said, overall, you've swung into a full-year headline loss per share, but very much related to dealing with the refinancing of the group's debt. So take us through your financial position right now and how comfortable you are with the debt position you're sitting in.
Alicia, afternoon. Thank you for that. I think we announced last year in detail all about our refinancing, and the once-off cost that you see in our results this year can be complicated, and for that reason we report on a normalized earnings per share and a normalized revenue and EBITDA. That'll give you a much better comparison in terms of the actual operational performance.
And on that basis, if we're looking at basic normalized headline earnings per share, you're actually looking at a 53% increase.
Correct, yes. We did the refinancing, and our new capital structure with the leverage effect gave us that sort of kick to 53%, and we also issued more shares. If you just look at a normal line, it's more than 60%, but with the more shares that we issued, it brings it down to 53% per share.
Let's take a look at growth then in terms of your three operating platforms. You've got operations in South Africa, in the UAE and in Switzerland as well. Just how varied operating environments are we looking at here?
Quite varied. I think the operating model differs quite extensively as well. I think as we've reported in the past in South Africa, the key difference is that we do not employ doctors. We are not the owners of radiology and pathology. Whilst in Dubai, we have a totally integrated operating model where most of the doctors work for us, and we own the total operations, including the radiology and pathology. And we further have referring multidisciplinary clinics distributed throughout Dubai, feeding into our two existing hospitals. In Switzerland, almost a combination of the two. We do employ some doctors, but the key specialists supporting our hospitals are independent. They practice on their own. So that is the key differences, I would say.
Okay, so let's take a look at it because, as you say, you're looking at different models within these various territories. You've managed to see an increase in patient admissions and bed days sold. Is this a matter of more people getting more sick or an actual raking in of market share that's growing in terms of who has access to private healthcare right now?
I think in South Africa it's very difficult. We cannot exactly determine our market share, but we are very pleased with the growth that we saw in our South African operations in terms of attendance and inpatient admissions. And obviously our industry depends on the health of the economy. The more people we employ, the more people can afford medical insurance, the more people will make use of our facilities. In Dubai, it is still a growth platform. I would like to claim that we've actually established ourselves as a quality healthcare provider. We created capacity in the beginning in the form of City Hospital. Last year, we expanded to the full capacity where we opened the last 30 beds. We acquired more clinics during the last year, the year before, and we saw good growth there, actually filling those capacity that we acquired. And as we've mentioned, we are still busy with further expansion in the UAE. In Switzerland, maybe just the last comment, there was a major regulatory change where we were quite happy to see that 13 of our 4 hospitals are listed on the list to provide healthcare also for the general insured, and we saw quite good growth in terms of numbers in Switzerland that we are very pleased with.
Danie, you've also highlighted in this set of numbers that you've managed to realize an increased average income per stay. I mean, how are you rating your pricing power, specifically here in South Africa, where we've got the Competition Commission set to initiate an inquiry into the private healthcare sector within the year?
Yes, Alicia, we must make a difference between price and the total spend on healthcare. And as we highlighted in our numbers, our price increase, the pure price, is less than 5%. In our case, about 4.5% price increase per patient day, which we believe is right in line with inflation, slightly lower. We also noticed some of the other groups reporting, and I think it's similar in line with what we reported. So affordability is a major issue. I think we realize that affordability links to sustainability, but we also need to look at the value that we offer. A lower price does not necessarily bring better value at the end of the day.
So just where do you sit in terms of bringing innovation through to improve efficiencies, because that would be one way of bringing the cost down and making healthcare more affordable?
Yeah, it's a statement you make to say how can we bring efficiencies in to make it more affordable. We would believe that we are running very efficiently, and we've managed that for many years, and we're very proud on what we've achieved in terms of cost management. We see our growth in terms of the cost and our maintaining our EBITDA margin very evenly over all the years. So only efficiencies, I'm not that sure, can bring cost of healthcare that further down in the private sector.